Dr. Williams, we talked about missing teeth and the havoc they create, which is to a very high degree, very cumbersome in life, headaches, shoulder pain, neck pains and stuff. It's quite amazing what you mentioned there of how that whole stuff is affecting life. Now, what are some of the main ways, or what are all the ways of replacing such missing teeth? Because new technology came out, lots of people talk about the new way is better than the old way. Is that really true, or is the new way just an addition, not necessarily always a better way? Shed some light on what can we do to replace missing teeth.
Okay, we'll start with the oldest way, so to speak, first. That would be what's called a removable partial denture. Basically, you take your teeth out at night. Okay, a metal framework that has teeth on it. I'm sure those who are missing multiple teeth from years gone by in their 70s may have some of those in their mouths. The next way is with a bridge. The bridge is permanent. You don't take it in and out. It's actually very destructive, though, in terms of replacing one or more teeth. You actually have to use anchor teeth, your own teeth, to replace one or more teeth. So you got to basically shave good teeth down to replace a missing tooth. My philosophy is, if it's not broken, why are you fixing it? The standard of care, in addition to the partial denture and the bridge, is dental implants. That's the state of the art. I actually have a dental implant. That is the best treatment option afforded to the public. It actually deals with the space only. So wherever you're missing a tooth, you only deal with that space. You don't jeopardize or shave down or what we call prepping good teeth to replace missing teeth. So you're not sacrificing your good teeth trying to replace one or more teeth. An implant is a titanium post that's placed into the mouth. It's permanent. You don't take it in and out. You never get a cavity with it. You can floss it. You can brush it. You can eat apples, applesauce, everything. It's just like a natural tooth. It's the next best thing that man has into what God has originally given us.
So you're saying such a titanium implant, which is the same material they use for hip replacements and stuff like that?
That's correct. That is correct.
Yeah, so you're saying that stuff is better than the wooden tooth George Washington apparently had?
Much so. I cannot imagine myself walking around with a wooden tooth or a tooth taken in and out of my mouth.
Well, probably in his time it was a lot better than having nothing.
Exactly, but in this day and age, you'll find some patients that still have the partials. For whatever reason, a lot of them don't know they have the option. As a matter of fact, I had a patient in my office just last week that my dental assistant was talking to and asked him, did you ever consider not taking your teeth out at night? He said, I didn't know that even existed because my dentist has just made me partials. So we educated him on dental implants, and now the patient wants to have implants done versus taking his teeth out at night and getting food up underneath it when they eat. It's cumbersome. When I was going through the process of getting a dental implant, had to wear a temporary partial denture. And I can tell you that was miserable. It flips around in your mouth, you get food up underneath it, and there's nothing like the original tooth that I had. Once I got my implant placed, it was no difference.
So let me ask you, a implant, you put one tooth in it. When you put a bridge, let's assume one tooth was missing only, so that would mean a 3-unit bridge, as you guys call it.
Yes.
Basically, you grind 2 teeth down like a bridge, and those are that's where it stands on, and then you hang
anchors,
and the anchors, and then you hang a third one, or for that much, 2 or even more teeth in between. So let's take a normal 3-unit bridge where like 1 tooth is missing, or 2, 4-unit.
Okay.
The price of one implant, versus 3 units, because now you need to do 3 ceramic crowns, right?
Yes.
So is the price between a 1-unit implant versus a 3-unit bridge still a lot different, or not really all that much anymore?
I like to say it's a wash. It's going to be as comparable to a 3-unit bridge. But the caveat with an implant is, with a 3-unit bridge, typically you develop problems with that 3-unit bridge 10, maybe 12 years down the road, and has to be replaced, like tires. With an implant, you don't replace it. It's permanent. With a bridge, because you can't floss the bridge, you get plaque and buildup underneath it, food particles, so you develop a cavity.
And the reason you can floss it, because the bridge is literally welded together. So you have three teeth, which has one tooth. It becomes a big tooth, and in between, you need those floss threaders. So if you're a little lazy guy like me, who, I made at one point an example. My wife, chews 2 bites while I chew a whole steak. She's still brushing on her upper teeth or wherever on one side when I have brushed, flossed, showered, shaved, and I'm ready to hit the bed. She's still, so very obviously she's more dedicated than I. So a guy like me, she might not have any problem with a bridge, because if she would go and she would floss, she would add that 3-minute to it, it would be not a problem for her at all. To me, it would be a problem. Not always, but I would probably sometimes miss it. Would that create gum disease, basically, which is what would make the bridge failing, maybe?
Oh, definitely. Definitely. Not only gum disease, but cavities, because you're going to get plaque bacteria up underneath that bridge because you can't floss it, because it's all connected one unit. So the process is very cumbersome to clean up underneath the bridge. And if you don't clean it thoroughly, you think you have cleaned it, but still there's remnants of plaque bacteria that's left behind, which in turn causes gum infection and causes cavities on the teeth. Versus an implant, you don't have that problem at all. You're able to floss it. It's just like your natural tooth. Floss it, brush it, eat with it, function with it, speak with it, and you can't tell the difference.
Right. Now, at the same token, you said why fix it if it's broken? So what about if their choice and teeth, however, have some problems already themselves? Would then a bridge be still kind of like something which wouldn't be necessarily a bad thing to do?
A bridge is still an option, but I would always recommend an implant over the bridge. If you still have adjacent teeth that say have cavities or they have large old silver fillings and they need to be crowned, why not just crown those and put an implant in the missing tooth space? Thereby you can clean it better and you don't have to worry about replacing that bridge 10, 12 years down the road. So hygiene is is easier, user-friendly with an implant for a patient than a bridge is, always.
And again, as you have made, by the way, can you hear the dogs barking? I have a neighbor with dogs. Can you hear them?
Yes. Yes, I can.
Unbelievable. Sorry about it. So basically the hygiene is what you're stressing, because if the hygiene falls down for any reason, even though it's possible to do, but you and me know that anything which becomes more difficult for us to do, we tend to then sometimes neglect it.
That is correct.
And obviously, as you again mentioned in another video, there's probably nothing more devastating in the body than the slow creation of gum disease, which is slow, it's painless, and thus it's literally like cancer, and actually probably creates some sort of cancer because it affects everybody but poisons the body. And you want to at any cost avoid that.
At all means you want to avoid that. Hygiene is the key, and that was the main reason why I went into periodontics, because it's the foundation for all dentistry. If you don't have a sound tooth structure, sound bone, your mouth doesn't have a good foundation, the rest of dentistry is for naught. So dental implants afford a person to have better hygiene than, let's say, a bridge, definitely than a partial would, and it's the 21st century in terms of dental technology.
Wonderful. Okay. Well, here you have it. So basically, the price really isn't all that much bigger from a bridge.
No.
And yet, at the same token, it lasts, from what you say, quite a bit longer, maybe for eternity. Right. So right there, as you mentioned, none of us likes to go to a dentist, so never mind the going. And then if you have to replace it, you have to, right there, pay double money.
That's correct.
Never mind the going.
Yeah, as with implants, the predictability of a dental implant is 95%.
Wow.
So I wish I got that in my stock portfolio on a continuous basis. So they're very predictable, very safe. And as I say, that's 21st century dentistry.
Right. Great. Absolutely wonderful. And you can chew on a spare rib? We can.
more than that. I tell my patients you can have apples versus applesauce. Okay, you can have a steak versus cube steak. So implants, it's just like your natural tooth. You cannot tell the difference, and the function, the fit, the comfort is outstanding.
Great.
So we're more than happy to see patients who would like to go down that route.
Thank you very much for your candidness, Dr. Williams. Bye-bye.
Thank you.